Guys, this is Mobeen. We're talking about cardiovascular system. This is the first lecture in the cardiovascular system physiology, the general principles. The topics that we'll cover today are going to be pretty simple. It is a start of the CVS. So the organization of the cardiovascular system, the heart as two separate pumps, the series and parallel circuits in the CVS, the chemical composition or the oxygen and carbon dioxide levels at various parts in the cardiovascular channel, direction of the blood flow in this circuit, and what do we mean by the systemic tissue and what are the systemic tissues. This is really important. You'll use this term throughout your medical career. And then various pressures and their definitions. We're not going to treat these things in detail here. There will be separate lectures, but just their definition so you can get started, and when these terms come up, you at least know what that means. So with this, let's start with the heart. So the USMLE wants you to know what are the heart's chambers, what are the valves, how does the blood flow in those chambers. So this is that lecture. So let's start from here. The heart here that is drawn, and you'll see a picture as well. It has 4 chambers. The 4 chambers are, number 1, if the right heart, right atrium, RA, and left atrium. That is one functional, these are 2 chambers but one functional unit, also called the right heart, the right heart. Then of course left atrium and left ventricle, that makes 2 chambers, left atrium and left ventricle, but that also makes the one functional unit, that is left heart. So I'll make that here, left heart, consisting of left atrium and left ventricle. The right atrium has 3 inputs. Superior vena cava brings the blood from the head and neck area, superior vena cava. Inferior vena cava, IVC, brings blood from the rest of the body except the heart, and the coronary sinus, that brings blood back from the heart. Coronary sinus. Now remember, heart receives blood to do 2 things. One is it receives blood to pump it out, so that's the pumping function, and the second is it receives blood to use it as its own nutrition as well. So when the heart is pumping the blood, the vessels on the right side are superior vena cava, inferior vena cava, and the coronary sinus. They bring the blood that is pumped out through the pulmonary arteries. So this is pulmonary artery. So here a quick definition of artery. Arteries are all the vessels that bring blood out of the heart, that bring blood from the heart outside towards the tissue. So this is the pulmonary artery that would bring the blood out from the left atrium, right ventricle. Okay, so that is the pulmonary artery, that is the right side. The left side has left atrium, left ventricle. The blood comes in through pulmonary veins, and the definition of veins is all the blood vessels that bring blood to the heart. So pulmonary veins bring oxygenated blood to the heart. These are veins. It is not necessary that vein has deoxygenated blood. Pulmonary veins bring oxygenated blood from the lungs to the heart, and so these are oxygenated blood carriers, but are veins because they are bringing blood to the heart. Okay, so left atrium and left ventricle. Left ventricle in turn pushes the blood or pumps the blood into aorta, and then aorta is connected to the systemic tissues. There are 6 major systemic tissues that you should know about. One of them is cerebrum, or the head and neck area. Coronary tissue, that is the heart itself. Splanchnic tissue, that means GIT, that is intestines, liver, spleen, etc. Renal systems or kidneys, skeletal muscles or just the muscles, the skin, and that makes the systemic tissues. Alright, so now these are the chambers and the arteries and the veins. let's see how this circuit is connected as a two pump system. We can see that here and we can see that here. So this heart, what I've done is I've broken it up. I've broken the heart into two separate structures. One is this is the left heart and this is the right heart. These are now functional units, the working units. So let's see the blood flow in this system. We'll start from the lungs. So here are the lungs. Oxygenated blood, you know that the lungs are connected with the trachea. The trachea is bringing the oxygenated blood from the mouth. Okay, so the oxygenated blood comes from the lungs through the pulmonary veins. These are the pulmonary veins, 4 pulmonary veins, 4 in number, 2 from each lung. They bring the blood into the left atrium. So this is the blood oxygenated that is coming in. Now what do you think about the chemical composition of this blood or the gaseous nature of the blood in this? So oxygen is really high here. Why is oxygen high? Because this is the most oxygenated blood. It is just coming from the lungs and the carbon dioxide levels are less. So that is the chemical composition. So the pulmonary vein and left atrium almost have the same chemical composition, more oxygen, less carbon dioxide. This blood through the mitral valve, we also call it, the same valve is also called bicuspid valve, or it is also called the left atrioventricular valve. Same name, 3 names for one valve. Through this valve, the blood flows from the left atrium to the left ventricle. Again, the composition is similar, more oxygen and less carbon dioxide. From here, the oxygenated blood now passes through aortic valve into the aorta. From the aorta, the blood will be then supplied to the rest of the body tissue. Now remember this, that only left AV valve, this valve is bicuspid or has 2 leaflets. All other valves are tricuspid in the heart. Okay, so the tricuspid valve traditionally is called, this valve, the right AV valve is called a tricuspid valve, although aortic valve is also tricuspid and pulmonary valve is also tricuspid. Anyway, so the blood comes out into the aorta. From here, it goes to the systemic tissues. So now what are the systemic tissues? These tissues, I've put them here as well. They will be called collectively as the body. So the tissues are cerebrum or cerebral system, or the brain or the head and neck area. Then subplanchnic tissue, that is the GIT, liver, spleen, etc. Then is the coronary, I missed the coronary here. Of course, heart itself needs nutrition as well. So the coronary blood vessels supply the heart. So coronary system, that would be bringing blood to the heart. Let's make that here like this. And we'll make a coronary vein, that is, okay, so coronary sinus here. That is the opening of the coronary veins. Coronary sinus. All right, back here, so renal system, skeletal muscles and the skin. So what happens is that the aorta then subdivides into arteries, then arteries divide into arterioles. They make capillaries inside the organ or viscera or the tissue, skeletal tissues. Then those capillaries have the venous end that make venules, then they make veins, and finally the veins would now go back and through either superior vena cava, which is bringing blood back from the head and neck area, or so we call it superior vena cava, or inferior vena cava,